Hey everybody, it's Dr. Hammerstedt from Holist. As promised, I have a Facebook Live for you today about hashtag Medical Monday, my input onto how the healthcare system works, and some simplified explanations and some misunderstandings and some thoughts about wanting your ideas about what your situation has been and how we can improve it. So, Medical Monday. So as you guys know, I'm an emergency physician. I have been practicing for 10 years. I love what I do. I also see, however, that more people than not are confused about how the healthcare system works, or they have no idea how it works. So I thought on this Medical Monday that I'd clear up some misconceptions and pick your brain about what to do about this stuff. So first of all, doctors come in all shapes and sizes, literally and professionally. The way it works is that after college, we go to medical school for 4 years. In the fourth year, we decide what specialty we want to go into, and then if we're lucky, we get accepted into that residency. Residency is a 3 to 6 year postgraduate training in the specialty of choice. You are a doctor but are supervised by bigger doctors, so to speak. And when you're done with residency, you either start working independently or you do a fellowship for even more training. And then we take test after test for decades to become and remain board certified. So this is how you get an internist, a cardiologist, or an emergency physician. Because of this subspecialty training, we don't all know everything. Going to the cardiologist about your kidney is not the right choice. They specialize in hearts. Going to the emergency department is not the same as going to your primary care doctor. And that's because we specialize in emergencies. So expectations about what you're asking for your doctors needs to be pretty realistic based on their training and their specialty. If a doctor wants to go into another specialty, we have to go back to residency for another 3 to 6 years. I mean, who's going to do that, right? So once you've made your choice and done your training, that's pretty much where you are. So you can tell that our training as physicians is very rigorous, our specialties are very narrow at times, and our flexibility is very different than nurses or PAs who have entirely different scopes of what they can do and should be doing and different training. So another big difference is that we all practice in different settings. So some doctors are hospital-based, some are office-based, some are employed by their practice or hospital, others run their group practices like a law firm partnership. This means that some are paid for their time and others are paid for what they do. So I've heard a lot of people who think that doctors get paid to write you prescriptions or do tests on you, which I was kind of amazed to actually hear this for the first time because it's so not true. What complicates this picture, and I think why it gets confusing, is that doctors can be, but are not always paid for the complexity of your care, especially hospital-based docs, meaning the sicker you are, the more care you receive, the bigger the bill is. But this, I think, makes sense, and I would think you'd probably agree if you hear of it that way. Another thing I hear all the time is that doctors are the problem with healthcare expenditures, and all I ask for that before I go on a tangent is that you pull out your last emergency bill or your last hospitalization or surgery bill and notice that the doctor's bill is probably about 10 to 15% of the total bill. So most is from the hospital itself for all the various things that went into that. So just think about that. I have no idea how we as doctors ended up being the culprit for the healthcare expenditure problem when we've dedicated our lives to training for and caring for you and for your family. One of the problems with how doctors are paid is that most doctors are not paid by the government or insurance companies to do preventative care or counseling. There's also little incentive for care coordination or communication, especially in the outpatient or kind of non-hospital settings, so this is clearly a problem. Another problem is that insurance companies have immense power and can decide when to pay your bill or not, and i.e. when to pay the doctor or not. And they often have the upper hand in determining how much they would agree to pay the doctor. So this results in what I think is coercive contracting for the doctors and surprise coverage for the patient, which means that you thought you were covered by your insurance and in fact you're not. All the while the insurance company gets millions and millions of dollars for their CEOs and everything else. So in fact, in Idaho, and around the country, I think in another 20 states, this is a really big battle and is likely going to push a lot of your doctors, especially those who are independent small business doctors, out of state or out of business. So in these issues, doctors and patients are 100% on the same side, and P.S. for those of you in Idaho, the time to stand up for yourself is now. So, what are we left with? Doctors and patients are struggling. Our doctors practice in silos. Our patients have trouble accessing the right care and the right way. Our primary care docs are overworked and underpaid. They want their patients to be healthy, and they don't have the time or the resources to help them do so. They're also getting paid for outcomes that they have no control over, meaning the insurance companies and the government is paying them for things that their patients have to decide to do for themselves, like lose weight, better diet, exercise, stop smoking. So that's really difficult for them. And what else? Patients are seeking health and wellness outside of conventional medicine with no one communicating about it. So what to do? I clearly have tons of ideas, and I'm fired up about this, and I have been for a long time, some of which I'm working with state and national medical societies and our state legislature. But what affects you listening to this is that my company Wholist is going to start doing whole you care coordination, consultation, and coaching. This will help you navigate conventional and alternative health systems, get comprehensive health and wellness planning, and bring everyone together in a team approach with you in the forefront and center. So I want to hear from you. What have you misunderstood about the health system? What has worked for you in health and wellness? What was a great care experience for you? What ideas do you have on how to fix this? How do you seek alternative treatments outside of the regular healthcare system? What would you give for a team approach for your care? I'd love to hear more from you in the comments or in person, so send me a PM. I'm trying to get everyone's perspective on what the issues are so that we can come up with an approach that works. Happy Medical Monday. Take care.